Welcome to Government Oversight. Senator Billy Hickman, if you will open us in a word of prayer, please, sir.
Let us pray. Lord God, thank you for this day, Lord, and thank you that you've given us an opportunity again to represent the people of Georgia, Lord. Even though a lot of times during this period of time, Lord, we feel like our boats are just filling up with water, Lord, but you always find the buckets to give to us to take the water out of the boats, and we thank you for that. Lord, we ask you to just help us to honor you in all that we say and do today. In your son's name we pray.
Amen. As you were talking about the boat, I was thinking about natural resources and some of the boat. They called it boat bills at boat bills. You were having trouble, but thank you. And also thank you for the Georgia Chamber for providing us some breakfast this morning and good Chick-fil-A, a good Southern meal. And somebody said it's called God's Chicken. If you will, first on the agenda is Representative Hawkins. Welcome and come on up. Let's do it. That's it. Come right up, if you will, please, sir.
Thank you, sir. Thank you, Mr. Chairman. And thank you, committee, for being here this morning in this bill. We're working off LC 520131S. It's a substitute to the bill, second substitute to the bill. This legislation calls for the creation of the Georgia Council for Addressing Healthcare Workforce Challenges. You know, when I was on your side years and years ago, Dr. Thomas had a committee that we went around the state looking at the nurse and physician shortage back then, 2007. We've made some good strides. We've increased our residency programs and teaching centers, but we're still sort of behind the curve. This state's growing rapidly, and some of our physicians and dentists and nurses are retiring a little bit earlier. And then COVID came along and really zapped us really bad. We're still down about 27,000 nurses around this state. And we've got hospitals that are suffering with nurse shortages. Stevens Hospital, Stevens County, right above Hall County, had to close down their OB ward because they didn't have the nurses to staff it. This is going to be a major problem, especially when the CRF funding runs out, which is right now holding our hospitals up, helping them pay for nurses and physicians from agencies. These salaries are much higher than what the hospitals have been experiencing in the past. It's increased it some by 300 to 400%. So once this money runs out, our hospitals, nursing homes, and other care facilities are going to be in a tough spot. So this bill is a study on what we need to do, and a coalescing of members and entities from around the state. In section, I'll just go section by section quickly, and I'll do it quickly. Section 1 speaks to the need of and the reason this commission is being formed, especially on line 19 when you're talking about the negative impact of shortages, especially on the safety and access to care, which is critical in this state. Section 3 speaks to the members of this council. You will see that members are coming from the educational side of this state, also representatives from the medical association, physicians, nurses, dentists, all other healthcare entities. Down on line 60, you see the Governor's Office of Planning and Budget, the Georgia Board, Healthcare Workforce, Licensing Boards, Board of Nursing, DCH, DPH, and then the chairman of the health committees and appropriations. So, it's going to be a well thought out, well versed group to deal with this issue. The administration of this is going to be through DCH. The council will meet at least twice a year. It's going to be a lot more than that. I can guarantee you that. It's going to work, if you notice over on page 6, it's going to work through some subcommittees, which is going to be very important because this is a massive undertaking. And to get this done, the entire 27-member board cannot work on one subject at a time, but breaks into subcommittees looking at different issues and addressing certain needs. It's not limited to those, but you'll see rural health care and hospital systems, educational workforce, those issues. And then you'll see that the council is then term limited to 2025. So it gives us 3 years to really address this issue. It's a complex issue, and like I said, it's going to be studied by clinical staff, experts from all different fields. It's going to be quite an undertaking, but it needs to be done. It has to be done. And I'll stop for any questions.
I know that this is a substitute. Could you address, if you don't mind, the changes that were made through the substitute? Are you in a position where you could do that?
Oh, yeah. Some changes were made to the original bill, and they're acceptable. The Senate does confirm, that's in our Constitution, that was added. We changed the Lieutenant Governor, changed that to pro tem, and then we made a change balancing out the number of selections from the Senate and the House. We moved the dentist from the House to the Senate, and so they all have the same number of appointments. And all those are acceptable.
Okay, we have a question. Number 6. Yes, Senator Jackson.
Thank you, Mr. Chairman. Just really quickly, one of the first representative that's listed on this council is somebody who represents K through 12 education.
Yeah.
Can you talk about why they're
You would
included
do
in
that.
this?
There has been much thought put into this area of dual studies, and you can take someone in their junior and senior year and put programs in those schools to begin nursing, looking at nursing or other health care additions. It's a great idea, and then they can get part of that and do maybe another year in a tech or a college and then go right into nursing, so you're short in the time. Yeah.
Thank you.
Good question.
Okay, thank you. Number 4, Senator Hicks.
Yes, I just got more of a statement type. You know, there's certain types of workers in our society who do it because they love it,
Right.
not because of the money and all. And I think the healthcare workers are definitely part of that. Public safety people are part of that. Teachers are part of that. And I think about these people that work in nursing homes and assisted livings and take care of people that are bedridden and all that kind of stuff. They do it because they love it. And that's what we got to find, that group of people that love this type of stuff. And of course, money's important, benefits are important, but it's also find them that love it and also put these credibility to it. Making
Right.
it exciting type of thing.
Right.
So I didn't realize there was that. We all know there's a shortage. We know there's a huge shortage. We know that our hospitals, particularly our rural hospitals, and probably all the hospitals, are having to do a lot of these contract nurses, and they're paying them $100 to $110 an hour.
Up to 200.
Up to $200 an hour, and that's really eating into the bottom line of it and creating a lot of maybe losses instead of profits. So we understand. So I was excited when I read this morning.
Well, I appreciate that. Those are good comments because, like I said, the hospitals and nursing centers and owned homes are being artificially held up right now with the federal funding.
Right.
That's going to go away, and so it's going to hit real hard. And we've lost also a lot of these folks because they're just COVID weary. I mean, we worked them to death for 2 years. We're hoping that a lot of these folks will come back, but can't count on it.
Yeah.
So, yeah.
I've also talked to some of our rural hospitals, and I've been into all the rural hospitals in our district, and they're all beautiful. They're all painted. They all got great floors, new equipment, all that.
Right.
But one of our CEOs said, you know, Billy, all this stuff is good, but you know what? We still got the same payer mix.
Right.
So at some point in time, when the federal government comes out of it, the payer mix, the poverty level in a lot of these communities is still real high.
Right.
If you got 20 to 30% poverty level, and you got 20 to 30% of people not going to pay, then it's kind of stuff. So that's
Right.
outside the scope of this, but
Right.
but that's obviously an issue too.
We've been looking at that at years. You know, Medicaid pays roughly 80% of cost to hospitals,
Right.
and then they have to bear the indigent care at no pay. So that translates much higher fees for us that have insurance, and that's been a problem for a long, long time. And you know, expansion Medicaid has been proposed, and something that needs consideration always. But at the same time, we don't have the providers to add another 500,000 people to those Medicaid rolls. Right now, you got children and age-blind disabled primarily, and you put another 300,000-400,000 on there. We're going to have providers, to take care of the folks, and the federal government's going to need to pay more than what they're paying. They say they are, but they're really not.
Yeah, and another statement on that same thing. We all know that if a hospital closes in a town, it don't open back up.
Right.
And we also know that if a town does not have a hospital, or a community does not have a hospital, nobody wants to live there.
That's right.
So
They don't attract new business.
So those communities
Right.
die. So this is, again, it's all outside of all this, but that tells you the importance of
Yeah.
what you're doing
Yeah.
here too. Thank you.
That's right.
Thank you.
Thank you.
All right. Senator C. Yes, sir. Yes, ma'am.
Thank you, Mr. Chairman. 40 years ago, I'm dating myself now.
Yeah.
Emory University sent a request to our high school trying to get CNAs. They was paying them and was actually giving them bus fare to come.
Right.
So thinking outside the box, if you want to get kids or younger people interested in the healthcare field, because many of them are clueless
Right.
and doesn't have a clue what they really want to do.
Right.
But giving an incentive of that nature can certainly start building a pipeline
That's right.
of students to start looking at healthcare, because we're going to need them forever.
Right. And this high school approach, early approach, gets them started in the hospital as assistants, like the candy stripers we used to have, and they can see what the job really entails rather than committing 2 to 4 years of their lives and then getting there and saying, I don't want to do this. Nursing's hard work. I mean, and so it's going to help reduce that loss factor of the people that we need.
And the last comment is that we all know that many of our nurses took those incentives to go elsewhere for the higher pay. And
Yeah.
places, I know quite a few of them left and, said, the money is so good, you can't turn it down.
That's right.
And they come home anytime.
I have some patients like that. They were working Northeast Georgia, and they found out about the traveling nurses, and they went from, I think, around $50 an hour to $150 an hour working at the same hospital, just going through the agency. So, you can't blame them, but at the same time, the hospitals just, they can't survive that kind of, Thank you, Valencia.
All right.
Oh, Senator C.
All right.
We
Senator-
cool. They break.
We've known each other a long time. Yeah.
All right. Senator Tillery.
Thank you, Mr. Chairman. Thank you, Representative. I agree with you on the problem. My question is, we're bringing on 27 people, the per diem, and a different board. Why would we not just do this through the Georgia Board of Healthcare Workforce that we already have with the 15 members it already has?
They don't have the manpower to do this. They don't have the subject matter people to do this. We're really not hiring 27 people. I mean, a number of these are going to be legislators that are per diem, but a number of these folks will be coming from their areas and actually donating their time. We'll pay for their expenses to get there, but I'm sure we'll be using a lot of Zoom too. So this is a mammoth undertaking, and the workforce lost their director, and she was a wonderful lady, good as gold, and they're trying to rebuild right now, and we can't wait, on that type of thing. And again, if you look at the people on this council, it's a lot of experts, and if you look into the bill also, it allows this council to hire or obtain experts in other fields, utilizing DCH funds to do that. I mean, it's a good idea, but this is going to be a mammoth thing. It's going to be a big thing to move.
The saving grace for you with me on this one is the sunset in 2025.
Okay.
And but I'll support it because of the sunset. I'm really concerned that we're not going to get what we need out of it, and I appreciate you bringing it.
Yeah.
Understand the task we're facing.
Yeah.
27 people. That's half the Senate. I don't know what I don't know that we could ever get that group to agree on what we need to do. And I want to express my reservations at the same time while
Yeah.
appreciating you trying to make some
Well,
effort
thank
to
you.
tackle the
I think,
problem.
yeah, to comment on that, I believe a lot of the folks that you see on this bill are going to have knowledge of this, like yourself on appropriations and chairmen of healthcare. You know, we've got some pretty good people lined up for this. And you'll be able to Zoom. Some of it, maybe all of it.
Okay. Looks like that's all. We've got 5 people on public input, so I'm going to get those, if you will, and let's we'll give them 3 minutes apiece. We've got Emily, is it Talley, I believe, and looks like, is she here? Come right on. Okie doke. Good to have you with us.
Thank you, Chairman Harbin, and thank you, committee members. I am Emily Talley. I'm the Vice President of Human Resources at Tanner Health System. And when I started there, almost 21 years ago, I was a recruiter. And I've had the opportunity, I grew up in Carrollton, so, small town, rural hospital. Father was a physician. So I've seen, Tanner evolve and grow, and even in my career, I've seen it evolve and grow. But the most challenging time we've had, and from the time that I took on leadership of the HR function really 3 years ago, 3 or 4 now, every leader I talked to was worried about recruiting and staffing. So it isn't a new problem. It isn't a COVID problem. We have been very fortunate because we do have very strong relationships with the educational institutions around us to be in fairly good position, but there are certain areas like respiratory therapy where we've had to use travel staff even well before COVID. And I can definitely echo, our current travel rates are $160 for nursing, and that's coming down. So it has been really difficult from a patient care perspective, and our own staff are burnt out. So trying to solve it on our own, we're doing tons of different things. We're working with our high schools that have career pathways. We changed our job descriptions to allow our nurse assistants to not have a high school diploma yet. Trying to take advantage of a lot of the dual enrollment. So we've done, a lot of creative things and in partnership, but it's still not working. We have 4 times the number of job openings that we did before COVID, and a third less applications. So, and it's not getting better. We still see patient boarding being a huge issue, and thankfully our COVID numbers are down. We just have, unfortunately, if you look at the health statistics, we just have a pretty unhealthy population we're having to take care of. And we do a lot in our community trying to help improve their health, but they're getting older and it's not going to get better. So I think it really will take some very innovative and creative solutions. I love the boat analogy in the opening prayer, to really, we have tons of students that we talk to every day that come as nurses' aides that try to get into nursing school, and there's just not spots. Try to get into respiratory therapy. We've tried to partner to get a program closer to us because they don't want to travel, because they really are community-based people and they want to help care for their community. So trying to figure out some new and innovative ways to help, because our people are exhausted, and really that's the danger of losing, is that burnout, because we can't get people to be able to help them. And it's not for lack of trying. I have an amazing team that's out there, but it's just all we can do.
Okay. Yep.
Okay.
Okay. Okie doke. Very good. No? Okay. Thank you so much. Appreciate it. Thank you, Emily. Tim?
Kibler.
Kibler. Yes, sir. There you are.
Yes, sir. I'm easy to miss, Senator. I'm easy to miss. Tim Kibler with the Georgia Alliance Community Hospitals. We are a voluntary association of 92 of Georgia's not-for-profit hospitals. The story you just heard from Ms. Talley is the story of all those hospitals. Nobody has the staff they need to deliver the care they need to their communities. It is our goal and our hope that in bringing together the educational community, the employment community, and the professional community, we will deliver some more pathways to Georgia students to end up in these medical professions, medical nursing, dentistry, and all the allied health professions. We've known for years we have a shortage in physicians. The COVID has really exacerbated the shortage in nurses, and as you heard from Dr. Hawkins, we are tens of thousands of nurses short, and the trajectory right now is for that number to grow over the course of the next 3 years. So we very much appreciate the approach that he has taken with a 3-year sort of a multi-pronged, multi-year approach to bring ideas together to enhance the likelihood that we will have the staffing needs for Georgia's future patients. With that said, Mr. Chairman, I'll try to be brief. If there are any questions, I'll be glad to try to take any.
Okay. No, thank you.
Thank you very much,
Appreciate
sir.
it. Thank you. Anna Adams. Very good. Thank you.
Good morning. Thank you, Mr. Chairman, members of the committee. I am Anna Adams with the Georgia Hospital Association. We represent about 160 hospitals across the state, ranging from small rural to large urban. And so I'd like to start today by saying thank you to each of you. Throughout COVID, I know you've gotten a litany of emails from myself and the hospital community giving you updates on what's going on in our hospital community and asking for assistance in certain areas, and you have always provided. So with that said, I would also like to thank you for your consideration of this legislation today, because this, in our opinion, provides us the resources that we need to make sure that even as COVID wraps up, we have the resources available from a staffing perspective to continue to serve the patients in our community and keep those services open. GHA's #1 legislative priority this year is a solution to the workforce shortage. That is a change from what we usually focus on, and I can say without hesitation that this bill, House Bill 1520, is probably the most important bill that we are working on and supporting this year. So would ask for your favorable consideration. Just a few statistics. Georgia right now is number 48 in nurses per capita in the United States. And to follow up on some of the questions that have already been brought up this morning, Chairman Tillery, you mentioned the Georgia Board for Healthcare Workforce. We have done some work with them in the past on this issue. We just do feel like this commission, or council rather, brings together some of the people that haven't been involved before and kind of forces that conversation with everyone at the table. There's not representation from the educational institutions on that workforce board, but we do have the chair of the Georgia Board for Healthcare Workforce listed on this. So from our perspective, this puts everyone together in one room to be able to come up with a solution, to both short-term and long-term, to this problem. And again, we would appreciate your support, and thank you for everything you've done for us thus far.
Okay. Any questions? None? Okay. Thank you so much. Appreciate
Thank you.
it. Deb Bailey? Please come forward. Thank you.
Good morning,
Good morning.
Mr. Chairman, members of the committee. I'm Deb Bailey, and I represent the Northeast Georgia Health System. We're a 4-hospital system serving all of North Georgia with over 10,000 employees. I am also a registered nurse, and I have been since 1974. So over those many decades, I have seen, as my system has seen, many nursing shortages, but we have never seen anything like we are experiencing now. Before COVID, we had about 100 nursing vacancies. Now we have 500 nursing vacancies in our system. In that system now, we're serving our community through agency staff. Our physical year for Northeast Georgia Health System begins on October 1. Since October 1, we have spent $80 million on agency staff. This is absolutely unsustainable. We, like many that you've heard before, have done everything that we think is possible. We've raised salaries. We're working with the city, the county, our university systems, but we realize this is a very systemic issue that requires a tremendous amount of evaluation and both expertise from all of the areas, and we feel like that this piece of legislation will help us to hopefully find some solutions that we've been unable to find on our own. So we appreciate your attention this morning and ask for a favorable vote. And thank you so much.
You have a question?
Yes, ma'am. I'd just like to ask you, I'm sure a huge part of this is COVID, we know that. But isn't a big part of this the fact that Georgia has grown so much in the last 10 years? I know when we did the redistricting, we saw that for the most part we said that Georgia grew 1 million people. Well, that's not really true. South Georgia lost 200,000 people because we know we lost a Senate district, and North Georgia grew 1.2 million people. So if you look at that obviously is a contributing factor, and our state's going to continue to grow. So we got several contributing factors to this shortage, along with the COVID, the growth, and so forth.
Yes, sir. Senator Hickman, I think you make an excellent point. And I think what we'll find when we start this study committee is that we'll find that our university systems, the nursing component of those and some of the other healthcare components, they are more expensive to do because you've got the clinical component too. They haven't grown. I think we haven't changed some of the rules and regulations of the nursing board to allow them to grow. So we've got, I think, a pipeline of folks out there that are ready to go, but we've got a lot of issues and a lot of hurdles for them to get there.
I think too, also, if you'd ask Mr. Chairman, because I think he sells life insurance, that the life expectancy that they are now putting on life insurance policy runs 105, 110 years now in a lot of cases.
More and more.
So more than that. So that's another factor. We're a larger population. We're just living longer. We're, as one of the people said earlier, a lot of times we're not taking care of ourselves like we should. Blah blah blah. So thank y'all. Thank you.
Yes, thank you, sir.
Okay. Thank you. Appreciate that
Thank
very
you.
much. Thank you. Julie Wyndham? Hello, Judy.
Mr. Chairman, members of the committee.
Come right in.
My name is Julie Wyndham, and I represent Atrium Health. Atrium Health has 2 large tertiary teaching and trauma hospitals in Georgia located in Macon and Rome. We also have 6 small hospitals in rural counties in Baldwin, Monroe, Peach, Polk, and Putnam. I just want to give you a brief snapshot of the vacancy rates that we've had in our nursing programs at those different facilities, and then show you how that has impacted patients. At Atrium Health Floyd in Rome, we have a 19% vacancy rate. At the Medical Center in Macon, we have a 26% average vacancy rate, with some units being having as high as 50 to 60% vacancy rate. And even our critical access hospitals have not been untouched by this. In Monroe, we have a 36% vacancy rate in our nursing staff at that critical access hospital. And these are despite several mitigation efforts that we made during the pandemic. We did 3 different pay raises during the pandemic to try to retain our staff and to reimburse them for what they were having to go through. Many of them were afraid to go home. They didn't have anywhere for their children to go because they were out of school. We set up daycares to try to help them with that. We also, during that period, raised our across-the-board minimum wage to $12.50 an hour to try to lift everybody up. And we did all this in addition to hiring additional contract workers, as you've already heard. And our rates there increased from an average of $65 an hour for a contract worker to $165 an hour during the pandemic. And all of this, unfortunately, did have a negative impact on patients. And where we saw that, the way we chose to address some of this was through bed closures. That's all we really knew how to do. It was either that or discontinue much-needed services. So at the Medical Center in Macon, where we have a 637-bed hospital, right now, even after the surges, we have a 60-bed average day closed. During the pandemic, that average bed closure was between 90 and 120 beds a day. And at our hospital in Milledgeville, which is a 140-bed hospital, they continue to have 25 beds a day closed, and a full medical surgical unit there at that hospital has been closed for several months. So that's the impact we're seeing from the shortage of healthcare workers. We certainly would love your support in this council. And Chairman Tillery, to your questions, I know that I can speak for my hospital, but I'm sure the sentiment's the same with others. We are happy to invest in the work of this council, to be a partner with the state, to help defray costs. We also are willing to help defray cost of any solutions that come up after this. We truly view this as a public-private partnership because it's something that we have got to address sooner rather than later. So I request your favorable support of House Bill 1520 and appreciate your time this morning to listen to our concerns.
Thank you so much. Thank you, Julie. All right. Senator Representative Hawkins, do you have anything else you want to close with?
Well, just a second. I think you've heard from all the groups here, and I think you've had really great questions this morning. I appreciate it. And to Senator Tillery, I will tell you the 27 could have been higher. I said no to EMS, and American Pharmacy Association called me yesterday. They wanted representatives on there. We've got a problem that extends all the way across the horizon, as you've heard this morning. So I would just end by saying I hope that I ask for your favorable consideration in your vote on this. Thank you.
Thank you, sir. Hold on. We have a question number 3. Yes, sir. Senator Muller.
Thank you, and my apologies for arriving late, but I ran all the way over here. I've caught my breath now. So.
We have oxygen.
Got my age, not supposed to run that hard. But I think that it sounds as though some of the concerns that I expressed to Representative Hawkins and others regarding the number of people on the committee have been voiced here as well. But you have so many different agencies and concerns and professions involved. I think that even though 27 is an unwieldy number, I think it takes that kind of number to get there.
Yeah.
And Mr. Chairman, at the appropriate time, I'd be prepared to make a motion.
Okay.
Thank you.
Okay.
I
We
know a
have.
guy has a car agency, so you don't have to run. Do I have that right?
That's why I'm late behind him.
All right. This would be an appropriate time, sir.
I would move due pass on HB 1520 LC 520131S.
Let's see. I have an LC 3390. Nope. Whoop. Excuse me. You're right. We got both of them here. You're correct, sir. Thank you. We have a motion from Senator Miller, and we have a second from Senator C. Do we have any other questions? Any other comments? Okay. All in favor, raise your right hand. All opposed? Okay. Motion passes. Okay.
You need to state the vote.
Vote. We've got 6. Which one? You know what you have? You got 6-1. Okay. Very good. So, Representative Hawkins, you are.
You can't see him. Representative Smyers on the other side of this.
Okay. Looking for. So you're to rules, correct? Okay. Thank you.
Thank you.
Oh, you need to state who's carrying.
Carrying. Representative Hawkins. Who's carrying?
Senator Butch.
Do you know?
What's his last name?
Yeah, I'm glad to carry.
Okay. I was wondering who was going to carry it. Okay. You think you qualified him? Okay. Senator Smiley is by. Smiley.
You can't see him.
Okay. I'm sorry. I'm looking here. I've been looking for him and I couldn't find him.
Yep, I'm here.
All right. Good morning, sir.
Good morning, Mr. Chairman. It's great to be here, Mr. Vice Chairman, members of the committee. I have a lot of friends in here on both sides of the aisle, and I'm just.
And you have a lot of experience as well. Am I correct?
After 48 years,
How many years?
48.
Only 48.
Yeah. It's,
Wow.
I thought about that, saying that when I think about this bill, when opportunity knocks, be prepared to open the door. And this is a bill of that significance. When the session first started, in addition to some things that I do around here, I'm chair of the Columbus Muskogee County delegation in the House, and our city council and our mayor sent me a bill asking me to introduce and signifying September the 11th as Public Safety Week, which I thought was appropriate for the state to recognize the tragedy of September the 11th and give it's some significance in the state of Georgia. And during the course of that time, I was contacted by the governor's office, and I started working with the governor's staff and Lauren McDonald, who is the governor's floor leader in the House. And they had a bill establishing Juneteenth as a state holiday. They asked me to, if I would be receptive to adding Juneteenth to the public safety bill, and that's what you have before you as a committee substitute. And Lauren McDonald introduced it in the House. In fact, there was another bill, Miriam Parrish, Representative Parrish from Macon, Georgia, had introduced a Juneteenth state holiday bill. And what this bill does by a Rules Committee substitute is asking the state to follow the pattern of the federal government and going from 12 days to 13 days for state holidays, and still have the 2 optional days that the governor has the discretionary power to still observe those 2 state holidays that are floating holidays, as you know. They occur both during the session and they're taken later on in the year. So with that in mind, we're going from 12 to 13 holidays. The last time we did this, I had the pleasure of introducing, I was the author of the bill making Dr. King birthday a state holiday, and that in 1984. So you'll see in the bill that now it's going to 2022, and that's the only significant portion of this. It's increasing it from 12 to 13 and eliminating 1984 and putting in 2022 as public and legal holidays established by the federal government. So basically, that's what the bill does. I've enjoyed working with the governor's team because the list of holidays is already out to the state agencies, and Juneteenth is on it. And the reason that they do that they follow the pattern, all the governors have followed the pattern of establishing the holidays based on the federal holidays and try to concur with the federal holidays. So, Mr. Chairman and members of the committee, basically that's what House Bill 1335 does, and Senator Jeff Mullins, Chairman Mullins, has agreed to carry it in the Senate.
We have a question here.
Yes,
Senator Dolezal.
Thank you, Mr. Chairman. Thank you, Representative, for being here and carrying this bill. You mentioned that this brings us in line with the federal holidays. Does the state currently recognize all federal holidays?
That is correct.
Okay. How many other states have moved to recognize Juneteenth in compliance with the federal?
I'll be very honest with you. I can't answer that question.
Okay.
I do know that that some states have followed suit, and most customarily, when there's a federal holiday, the states that, I know Georgia has been in that arena, that we follow the federal guidelines of federal government.
Okay. It looks like it might be 6 that have done so far, if Google's right, which who knows. What's the cost for the state to have a paid holiday?
I don't know the answer to that. I know that when state is closed, the course of businesses are closed, and I would have to get that number from the governor's office as to what the cost would be, because the other holidays are costing the same amount, I would assume, if the offices are closed.
And forgive my ignorance on this, but this would close all state agencies, including schools, K through 12, higher ed, et cetera.
Yes, it would be a federal holiday.
It does not mandate, however, the closing of private companies, banks, et cetera, or does it?
Federal holidays, all banks are closed.
Okay. Thank you, Mr. Chairman.
I will say this, in Columbus, Georgia, we already observed Juneteenth.
Okay. Senator.
Yes, sir. Me?
Yes, sir.
Okay. Thank you, sir. Thank you for being here. I guess I'm a little bit confused with the bill. I guess we actually got 2 parts of this bill. We got one part that moves the holidays from 12 to 13.
That's correct.
And then we got the second, which ties in, like you say, with the federal holidays. And then the second part is the week in September, during which September 11th falls every year as designated Public Safety Week. So that's an entirely separate situation. So there's no, you're not recommending any holiday for the September 11th.
Oh, no.
You're just recommending that be designated as Public Safety Week.
As an observance.
Okay.
We do that a lot through urgent resolutions and personal privilege resolution in both the House and the Senate.
And to kind of follow up to Senator Dozal's question about the money situation, I think Andrew, I did ask Andrew before the meeting, and he did a quick down and dirty calculation on it, so I'm going to rely on his number, but he said it's roughly about $130 million to close off this one day. Now, it may not be right. It may be $100 million or maybe $150 million, but it really is a significant dollar amount. And of course, my concern with that, we still, and I'm kind of hung up on this concept, but we still, and we talked about it a bunch, we still got a bunch of state retirees under state retirement system that has not received any type of cost of living in like 10 or 12 years. Now, I think this year we're going to give them we are prepared to do a 1.5%, which is about $140 million, as I understand. And that's about 55,000 people that really haven't had any type of cost of living in 10 or 12 years. So I'm just very sensitive to the numbers. I'm very sensitive to the dollar amounts and all. I agree with the holiday side. I don't know if I agree with the dollar amount of being paid for the holiday. Thank you, sir.
Okay. Any other comments? Oops. Senator Steve, Tennessee.
Appropriate time, I'd like you to pass.
Okay. No comments, no remarks otherwise. Okay. Appropriate time, we have a motion from Senator Say. We have a second. We had a second from Senator Jackson. And any questions? Yes, sir.
Personally, it's pretty important for me to know what his cost is. I don't know how the other members of the group feel. I don't know what I can do about it, but it's pretty important.
I think that's a valid question, sir. Our illustrious President Pro Tem, could you give us an answer on that?
No, maybe what I'm going to say is maybe we need some additional answers before we vote.
Okay.
I mean, I don't know what the economic impact is, and I'm not against the bill, not for it or against it. I want to know more about it before we vote.
Okay.
What does it cost, and so forth. And I think we.
Okay, I think that's a fair question with where we are. Hang on just a sec. We have one.
Chairman, I share the same questions, and I would love to maybe revisit this. And if you would accept the motion to table, I would like to make a motion to table this.
Okay.
Is anyone here from the governor's office?
Senator Say, if I could get you to withdraw your motion for right now so we can get this, we've still got another hearing next week. I think getting that information, rather than have the bill where it is right now, it would be wise to just see what the cost of this is, if you're willing to do that. Plus, is that that's okay. Okay, very, very good. Okay, thank you.
May I interject one thing?
Yes, sir.
I just got a message from the governor's office that there's no physical impact to the state because the employees are salaried, and that I know that's part of the economic impact, part of the number that would be calculated. I don't know the total cost, but the fact of the matter, when the state employees are off, that's not a cost related because they're already salaried. They're going to be paid anyway, so they want me to know that.
Got you. Okay. Senator Say.
I'd just like to make a motion.
You got to deal with his motion.
Hold on. We've got another motion over here. With
I whispered a question to my neighbor here, and there's, I think, some question whether or not all state employees truly are salaried. I think I received a definitive shaking of the no that all are not salaried, so there would be a cost. I think it's worth digging into that, Mr. Chairman, so I would make a motion to table.
Okay, we have a motion to table our discussion. We can take that. I know we also have, and I'll ask this, Senator Tillery, since you are probably more in the numbers than any of us, do you have any input on that situation, or would you like to?
I do not know the fiscal impact. I'll tell you that. I would venture to say that most of our employees are salaried, but they're not all salaried. But I would say the vast majority are going to be salaried. I just don't know I don't know the breakdown.
Okay, thank you.
Well, I stand corrected. I'll say mostly, but not all, okay?
Yeah, I would agree. I would agree. There seems to be
And the
some,
businesses have the option to be closed. It's not automatically closed. It's just there's an option. So there's some clarity to that as well as it relates to the fiscal impact. And
okay, we have a motion from Senator Dolezal. Do we have a second on his? Any seconds? We got a second from Senator Hickman. Okay, so we've got that. Any further discussions of where we are in the process?
Mr. Chairman?
Yes, ma'am.
May I ask my colleagues, is it, what part of the bill that they're really having trepidation with? It seems like it's two parts, and I'm just trying to be clear on what it is we are tabling it for, so that we can all be on the same page.
From the motion that's been made and where we are, is this: what is the economic impact of this bill? What does it cost the state, the taxpayers of Georgia is what it really amounts to, because it's not the government, it's the taxpayers. And I think that's what we're trying to get that number, or at least an idea, because most of them, as we hear, are salary-based, but there are other costs that are involved as well from that standpoint. And I think that's why we're just saying we'd like to have that information on hand to be able to move this thing forward. And we've still got another meeting that we could do as far as that.
And that meeting is when again, Mr. Chairman?
So would you speak that again? I'm sorry.
The next meeting again?
It'd be Tuesday morning. Okay. We've got a vote on the motion to table, if we will. All in favor, if you'd raise your hand. 3. We got 3. Okay. All against? Okay. So we got four tabling and 3 for no's. Two. Okay. I think we need to get an answer, and when we'll do that portion. Thank you, sir. We will get that done. And with that, we will dismiss. Thank you, sir. Appreciate it.